Medical emergencies affect millions of people every single year. And there's so many reasons to this. The scary thing is that they can actually lead to death. And the reasons for death in such cases can be because of limit to access to healthcare on time. It can also be to medical errors and so forth. Today on Teledoctor, we are going to unpack a very, very important topic, which is based on the basics of first aid. And so because of this, we're going to learn on how we can increase the chances of survival in such patients so that we can learn how to take better care of them in our communities. Ladies and gentlemen, I am Teledoctor, and I'm joined by my co-host, Dr. Blessings Kasenge, and this is Teledoctor. Dr. Blessings, you're welcome.
Thank you so much, Dr. Tapiwa. It's a pleasure. I'm co-hosting. I know I'm used to hosting, so I'm getting used to actually co-hosting with you.
Yes, it's such a pleasure to have you. And I'm super, super excited today because we've got a special guest who is a specialist in this field, and that is Sister Mwila. Sister Mwila, you're most welcome.
Thank you very much.
How do you feel to be here?
Well, it's nerve-wracking, but I think I'm okay. I will be fine.
Great. You will be. Ladies and gentlemen, here at Teledoctor, you can call us and you can also drop a comment on Facebook. Our numbers are 0979 9040 46. 0979 9040 46. So just before we delve deeper into this topic, we'll go into an ad break and then we'll be right back with you.
That should be on your mind. Mafipe, welcome.
Thank you. Thank you for having me.
What is a good investment? You should also address what is a bad investment.
Okay. I think a good investment is a clear investment.
It means just define what clear you mean.
At the end of the process, you'll be able to determine what you've benefited out of the business. So let me give you an example. If I invest in a bond, okay, my yield, what I will get out of it is known from the very start because somebody else is managing it and I come to the end of the investment and I expect an outcome.
Yeah.
Okay, if I'm building a house, for example, I understand that the number of blocks gets me to a certain point and the value increases. But if I'm investing in a hardware store, for example, I've put money in. The only way I'll know whether or not we're making progress is if I have some kind of credible set of accounts or records or information at the end of the process. A bad investment would be one that's not clear, one where I can keep on investing money and ultimately yield nothing at the end of it.
Okay, so what's your message about this bad, good investment to the people this week?
For you to evaluate an investment, to know if it's good or bad, look at your own circumstances. How much time and ability do you have to supervise it? And what are you getting back at the end of it? Is there a report that explains what the performance was? If you have those things, you can make a good decision around what the investment should be for you.
Very informative video on health and wealth. It's important to always know the link, between your health and wealth. And it's so great that here on Teledoctor we get to learn about that. So we're right back here discussing basic first aid. And like I said, I'm Dr. Teledoctor, who is co-hosting today with Dr. Blessings Kasenge and our special guest, Sister Mwila. Dr. Blessings, what's your take on first aid?
First aid is very important. I think that, one of the reasons why people die is because first aid is not administered correctly. And that's why I feel this topic is very important for us to be able to teach the public generally on how to handle some emergencies. And, we get to experience so many emergencies. Most of these are actually unexpected. You're probably in a home eating your dinner or your supper, you're eating fish. Next thing, you're choking on a fish bone. So you don't exactly know what you're supposed to do. Or you could probably be just in your home. Next thing, your neighbor comes to you and says your child has drowned. And then, so what are you supposed to do in that particular situation? Or probably the person sitting next to you probably just faints or just falls to the ground and you don't know what you're supposed to do. So your response time is extremely, extremely important when it comes to first aid. And we've seen so many bad habits, especially as a result of most people, how people react to these accidents. Some of them have been the people like capturing. When there's a road traffic accident, the first thing people do is want to get their phones and capture, let's see what's happening and all that, share on social media, and we get to forget that life itself is very precious, and how we react, particularly time, is of the essence in medicine and in health. So it's extremely important that people know exactly how to react whenever they see some of these particular things. And also importantly, Dr. Lukuta, as well as Sister Mwila, you find that we associate everything to witchcraft in our setting, in our communities. When someone falls to the ground, hey, witchcraft, somebody has been bewitched and all these kind of things. So we find that before people think of taking someone to the hospital, there would be so many things that would happen, and people end up dying along the way. Others die in the ambulance, others die immediately they reach a health facility. So it's important that we get to just educate the public on how to handle those particular issues.
Great.
That's why this topic is an extremely important one.
That's true. That's true. And I think it's also a problem that we always think that we leave such business to healthcare providers. So it's great that we get to have these conversations and have specialists who can guide everyone. So that is the entire public. And talking about the entire public, if you feel that you've got something, you've got a comment to add on, you want to ask a question, maybe something has happened as we speak, we have our specialist who is here on standby, as well as us, to answer any of your questions, any of your queries. Just dial us on 0979904046. And if you're on Facebook, you're watching this on Facebook, you can also just drop us a comment, drop us a like, and we'll be sure to respond to that. So moving on to you, Sister Mwila, like I said, it's a really, really, really huge pleasure and honor to have you here. Please tell us a little bit about yourself and the work that you do.
Okay, so thank you very much for having me. So I'm Sister Mwila Chilambwe. I'm a registered nurse general. Then I also specialized in emergency and trauma nursing, which I studied at Lusaka School of Nursing, graduated in 2020. So I've been working as a registered emergency and trauma nurse since 2020. It's now 5 years down the line. I'm currently working with Ministry of Health, UTA Children's Hospital. I'm the sister in charge for OPD and emergency unit.
Okay, that's a huge CV. That's a beautiful CV, actually. So you're definitely the right person for the job, the right person to delve into this topic deeper for us. Yes.
So.
And as our topic says, we're talking about first aid. So would you want to explain to us what first aid is?
Well, first aid is the first and immediate assistance that you give to a person who is in need of, who is in a medical emergency. So it's done to preserve life, prevent complications, and also prevent possibly death, or maybe improve recovery chances before medical services or before getting to the hospital. So basically, it's pre-hospital care that you give to this person who is in a medical emergency. Yes.
Would you want to?
Yeah, I think the question really for me was, I think I really love the fact, the way you've explained it. I think maybe for just lack of a better term, just aid is like help, right?
Yeah.
So it's a first help that you give to someone who's probably had an accident. So most of these actually happen within communities and within homes. So then who is supposed to give first aid?
Okay. So basically anyone can, but the best person will be someone who's trained and certified, because they know the techniques and what to do, the procedures to follow, how to go about it. Because when it's just been done by people, let's say an accident has happened, we see a lot of mishandling. You see people just pulling someone is holding their legs, the other one is holding the arms. So the best would be someone who is trained. But then we have very few people that are trained, and I haven't seen any trained first aiders that are stationed at markets or anything. So it would be important to train the marketeers, the security guards in these places, so that we know that they are certified people that can attend to these people. So it doesn't really need nurses and doctors. Anyone can be trained and will be certified to provide these services.
Yeah, I've actually heard that there's some countries where the people who are trained, first aiders, they just like line up along the road, so that in case of any accident, like they quickly rush. But unfortunately, we don't have those things.
We
don't
can't
have
afford.
One day.
We can't afford. I'm assuming those are paid experts who do that.
I think we can train people and employ them, but then I think we'll come to the aspect of what recommendations would make and what we'd love to see some of the changes, especially with regards to first aid. So then coming to the situations themselves that require first aid within the environment. I know I did preempt some, but just share a bit more detail in terms of what are some of the things that would require first aid.
Like some of the situations that
Yes,
would okay. So maybe that would be anyone's, you're at the market, you're at the mall, suddenly someone starts seizing, they're having a seizure.
Yeah.
They would need first aid because first of all, they fell to the ground. They are probably injured, their airway is probably blocked. So you need to help them in a better position so that they don't choke and die. Yeah, in a mall, someone suddenly falls, it's a heart attack, cardiac arrest. All those are things that will prompt someone to give first aid. Children are playing outside, someone picks something, they are reacting to it, they are allergic, you see hives, you know that they need first aid. Maybe bitten by a bee or anything, or even a snake bite. So there are all these things that will require you to give first aid. Even burns will require you to give first aid, yes.
So in your experience, do you think people actually give proper first aid? Like just in your experience, I know that you're working in a hospital and probably you receive people from the communities. So maybe they come with so many things. Others maybe I don't know what they come with. Others maybe they come with bandages. Others they come with strings. Maybe for example in snake bites they will like tie them and all that. So do you think people really give the correct first aid in our communities?
Rarely. Most of the time it's wrongly done. Rarely, because if you're going to talk about a child who was probably fallen or maybe someone has been bashed and they've sustained a fracture, they won't probably align that limb. By the time they were putting them in the car, they were just pulling them all over the place. So all those are things that will worsen an injury for someone. So our people are not yet equipped with that type of knowledge. They don't really know. Like you said, that someone will get a phone and start capturing instead of helping, and there will be people that will be pulling and just throwing people in a vehicle. So on very few occasions have I seen people do the correct thing, but most of the time, if it's done wrongly, but 90% of the time nothing is done. Someone will just come in a taxi for that matter, and by the time they get to us, we are probably gone.
And I feel like it's easier for us to talk about the less serious conditions or the more common incidents like drowning or someone choking on something. But then what then do we do in cases whereby it's actually a serious medical condition that someone has? How should the community react to that, or the people in the immediate environments? For example, someone is seizing, so that's a medical condition. So how would you recommend they go about that?
So first things first, you need to clear the environment, and you need to ensure that it is safe. So if there are people rounding up, you need to clear them because this person needs to breathe. Then you need to turn this person to the side so that if there are any secretions that will be coming out from the mouth, they need to just freely flow. You need to remove any tight clothing that are there, and you also need to support the head as they are seizing. At the same time, you don't need to restrain them, because someone will be having a fit and people are holding them down. You just need to let them fit freely. The only thing you can support is the head while you turn them so that they are in that position. Secretions can easily flow out. And by the time they finish seizing, their air will still be very, very clear, and they wouldn't have choked or aspirated.
And it's good we have her here, Dr. Blessings, because I've seen instances whereby perhaps someone is fitting and then they're trying to either wake them up, they're trying to, turn them over to try and control the situation, So it's really important that we get to know that you just leave the individual on their own to fit. What other conditions are there that...
I think maybe just before we come to other conditions, I think before I lose my thought, I think in that initial stage, like this is probably someone who has collapsed. I think among some of the common mistakes, I don't know if it's a mistake or it's the right thing, I'm going to hear from you, is that we get water and just like pour phone, place
Don't even do
online.
that. All that is wrong.
Yeah,
Just
so apart from
clear.
that, what are some of the other common mistakes that happen just before, like in that initial phase, like just being called to say, oh, Afenta, oh, Ashtashan, and then like you go there on that scene. Like, what are some of the mistakes that people would make apart from just pouring water?
So I think people will be crowding, and then if someone is fitting, maybe they are biting their tongue, someone gets a spoon and they're trying to push it in. Other times someone is fitting, you don't need to push anything into their mouth. Leave them alone. Then if someone has just fallen, you need to check their pulse. I don't know if our Zambian people know very well how to check the pulse, but you can check for the pulse, you can check if they are breathing, you can position them so that choking in this situation is the major issue. So once you are certain you've assessed this person, maybe they've stopped breathing. I don't know if our Zambian people are equipped with the knowledge about CPR, and I don't know if they'll be able to perform CPR, because if they've stopped breathing, their heart has stopped beating, the next thing that you need to do is CPR. Yeah, but then you only see people, you know, everybody will be there, but nobody is really helping this person. Imagine if we started CPR right there and then when
So
somebody
what is
just
CPR?
falls.
Yes, exactly. Before we go further than that.
Oh, sorry.
Yeah.
Go further.
So that is cardiopulmonary resuscitation. So the patient has stopped breathing, their heart has stopped beating. You immediately start massaging the heart, you know, with all your might between what's the simplest way so that people there can understand, between is it the breastbone? You're pressing like that.
Just below the breast.
Yeah, simply trying to restart the heart so that it can start beating and blood can start flowing to all the vital organs. But then we'll be watching this person instead of performing the CPR. And I understand, because we haven't done much as a country, and as health workers, we are actually maybe to blame. We haven't done so much in educating people about CPR. Because if we did, I think 90% of the people that come in as BID would have survived. Yeah.
And talking about the heart, ladies and gentlemen, we're going to go on a short ad break to discuss ECG 24/7, and we will be right back.
Ambuya, are you okay? Thankfully, with the Teledoctor app, you can get premium healthcare from the comfort of your home. With the Teledoctor app, all it takes is a click, and you could not only have a nurse or doctor come and see you, you can also receive specialized services such as nursing and physiotherapy.
You see, Teledoctor aims to make access to healthcare services cheaper, faster, and convenient.
Patient app registration. After downloading the Teledoctor application, to sign in, click on the sign in button. This will lead you to a page where you can create your own account. Fill in your phone number and email address with a valid email address. Create a new password, being careful to add an uppercase letter, a lowercase letter, a special character, a number, and a minimum of 8 characters. Fill in your names, sex, date of birth, and click to agree to the terms and privacy policy. Then, click the sign up button, which will redirect you to the login page. Fill in your email address and await a one-time password in your email inbox. To complete the two-factor authentication, copy and paste the number emailed to you and press the login button. Then, welcome aboard! You would now have effectively signed in and are now ready to use the Teledoctor application.
So, ladies and gentlemen, you are back with us here on Teledoctor, and we are discussing first aid with our special guest, System Winner, as well as Dr. Blessings Kasenge. Before the break, or before you left us for the break, she was discussing a lot about CPR, what CPR is, and the correct way to actually perform CPR. And talking about CPR, talking about the heart, I know it's a very broad topic, but one common thing that we see, and I think most of even the people watching there, is the issue of heart attacks. Right. So with heart attacks, how can we actually identify that someone is about to have a heart attack, and how can they quickly manage that case or that situation?
Oh yeah, so most of these people that will have a heart attack, these are usually people maybe that are already suffering from cardiac conditions.
Okay.
But then we rarely teach people in detail about what to expect or their relatives. I think there are myths. There are so many myths that we don't want to go into. Because if Dr. Blessings comes to the hospital and I start telling him what to expect, to say, you know what, one day your heart may just fail, he's just going to tell me back to sender. So most of the time we avoid going into those details, but some of the things that people can actually take note of, or even the patient themselves, that's sudden chest pain, tightness, pressure. There'll be this radiating pain to the left arm, the back, and the jaw. So the moment you feel that, you feel this pain, I think you tell someone, you can even lay down and tell someone, and I'm sure most of them are already on certain medications that they would have discussed with the doctor that they can take before anything goes worse, or before they go to the doctor, they would have already started taking these medications. Yeah. So those are some of the ways that they can recognize that they're about to have a heart attack.
Okay. Okay. Yeah, it's a very, pertinent issue, because you just hear, oh, they just fell. You know, and I've heard actually that some of these patients have this imminent feeling of like they're about to die. Most of them, like it's like they actually feel that aura that they're about to die. That's the crashing chest pain. No, so it's very important. Do you have anything to add on?
And I think for me, that's actually a very good point that you've actually brought out. I think for me the most important part is, now that we're at the danger, I think you talked about CPR. I'm not sure if our listeners got that. I'm just really hoping that they did, because like everything, I think, is hinged around understanding exactly how the body works. Right? So within the body, you've got the lungs, you've got the heart. The lungs are just, they help in breathing. And of course the heart pumps blood to all parts of the body. So when these two organs are failing, for example, in the case of an emergency, that's where now the resuscitation you talked about comes in, where we're just trying to restart them so that at least you can go back to your normal functions. So another part now is this patient, of course, we've gotten rid of the danger. I've got minutes in my phone. Who do I call at that particular point? If I've got an opportunity to call someone for help in that particular instance. Let's say maybe an accident has happened in Shimabala, or it could be maybe in Kafiwe, or somewhere in the valleys. Somewhere in the valley, and then there's an accident and I'm there and I've got a phone. Who am I supposed to call in that particular instance?
Unfortunately, our ambulance services are not, I don't think they are available for that. I have seen some private ambulance services, but I don't know how wide their services are. But the best is, this is 2025. At least we should have ambulances stationed in certain strategic places, so that should such things for, and we should also have a hotline where you can easily go. You actually don't need to wait to stabilize someone. While you're trying to stabilize them, you're also calling for help, so that the next person can also start calling someone else with a vehicle, which should be an ambulance. Most of the time our victims are transported wrongly in a taxi. Imagine this is a huge man and he suffered a cardiac arrest, or he had a heart attack, or he was involved in an accident with a fractured leg. Meaning when you put them in that taxi, how are you going to align them? The fracture now becomes worse, because now you're talking about maybe blood vessels being injured, the tissues being injured, and yet it was just a fracture that we would have maintained as a fracture. By the time they get to the hospital, it's a whole different story. Yeah, and which possibly will delay bone healing. So we are supposed to have ambulances that we can call when such things happen. And Zambia has trained paramedics. We have paramedics being trained at Chainama, and they are quite a good number. So those are the people that should be in those ambulances, because they are the responders.
But the best I can do is at least I can call anyone that I think can help. Maybe who could be nearby.
You actually you actually book a yango.
Or if I've got Sister Muela's number, I can just call Sister Muela. What do I do?
I'll tell you bring the patient to the hospital. I think that is what I'll just say. So, bring them to the hospital.
Bring them to the hospital.
Because there's no ambulance for me to.
But I think it's also a business idea. For anyone who's watching who has had, an idea of what to do, I think investing in healthcare is something that we can actually look into as being lucrative. So we can have more of, people from the corporate sector who hopefully are also watching this program, investing into our healthcare systems, because the government can only do so much. And for us to burden the government so much with so much responsibility, it's a lot. It's a lot. So I think if we all come together, the business people also invest, we fundraise.
Just forming those collaborations and seeing how best we can improve that particular aspect as well. So here I am now. The patient is not breathing. I've checked for the pulse. I can't feel the pulse. I actually think they're dead. Can I go ahead and do mouth to mouth? Can I go ahead and just push in some air?
Because that's what people think CPR is. Most people think CPR is just mouth to mouth.
Can I go ahead and do that? Is it allowed?
So this person has suddenly fallen. You've aligned them. You've made sure that wherever they are, it's safe. They can't injure themselves, or you can't injure yourself. So you've checked for the pulse. You've checked there are no respirations. You also need to check the airway. Maybe it's just blocked. Maybe the tongue has fallen back, or maybe they were just in a wrong position. So once you align them, the airway opens and they start breathing. So those are some of the things that someone can do immediately. You need to assess the airway, breathing, and circulation, because these three work together. Before you can even start that CPR and giving that respiration. So you need to do the chest compressions. Then, if you're okay with breathing into someone's mouth, I think you will go ahead. The last time in 2019, when I visited China, they have these small devices. They actually look like connectors to the vent that you can actually connect a mask to and breathe into. So that is how you give CPR. So you're well protected. But in our setting, maybe we'll just do CPR. I don't know, unless you're comfortable. I know with the diseases, there's COVID, there are all these diseases. There's herpes, there's HIV, so you just don't want to go into somebody's mouth that you don't know. But
that's true.
Like you said, if we invest in healthcare, then we have all these equipment that we need. I think it will.
And I think it's just important to actually remember a friend of mine sharing some time back with me that he had gone to work in a rural area, and then of course he had an emergency, so he was doing CPR. And then, because I was doing CPR like that, people don't know how exactly CPR is done or how the compressions are done. So everyone assumed that they were killing their person. I was even seeing that they were strangling him. It's the doctor who has killed. The doctor who has killed the patient. So, sometimes people may not really understand in the community, and they may think that you're actually doing more harm by doing the compressions. So that's also another point of just raising awareness and making people understand exactly why you're doing what you're doing. I can imagine if you're even in a crowded place, maybe as you're doing it, I don't know if you could explain and tell them to say, so I'm trying to research.
No, it's not possible.
It would be hard because it's not possible.
No, and I think that's a very important talking point, Doc. Educating the public, and educating the masses really about this very important, should I say, topic or aspect, which can affect anyone. I don't think most of us really prepare for it. It's easier maybe if you're if you already know that you're living with the patient at home, maybe someone who's diabetic, if you see them fainting, then you know, oh, probably it's because they didn't take their shot, you know, of insulin, they have not taken their meds. But if it's in the public and something random just happens, someone just falls and no one knows what to do, you know, I think we really need to work hard in terms of educating the general public. So do you have any idea of any efforts from government to actually educate the public or the masses about first aid? Are there any trainings that they're offering, any sensitization programs that are available for the general public?
Well, apart from Chinama offering that paramedics course and the Red Cross, I don't know of any. But I think these are some of the programs that need to be incorporated in schools. School children need to know.
Right.
Teachers need to know very well how to perform CPR, how to resuscitate, how to stabilize these patients, because some of these things will happen in schools. Then companies also, workplaces, people need to be trained. At least there should be a group of people that are trained in first aid and they are certified, such that even when they have an emergency, the patient can first be stabilized right there and then before they even start looking for a vehicle and start bringing the patient to the hospital. Because like we said, time is of essence. In emergency, it's all the golden hour. So that hour has passed. By the time you bring this person to us, they are already probably brain dead, and there's literally nothing that can be done about it. So if we go out there and train people in markets, in malls, in companies, in schools, then everybody knows. It means even in our communities, we'll be safe.
Yes, yes, that's true.
We'll be very safe because there'll be people that are trained to do all these things.
Yeah, and definitely, I mean, education is now free, so we're assuming that most children are in school, and it's better to catch them young, teach them how to do these things. But if you're watching this and you're actually very interested in first aid, giving first aid, and how to do it, I've got very good news for you. Teledoctor has a corporate wellness program of trained specialists who are actually giving certificates to either institutions, to companies, businesses, and individual groups. So if you're interested in this, do make sure to visit us on our Facebook page, get more information on how you can do this. But for now, we are going to go on an ad break to talk more about the Teledoctor app so that you can get yourself signed up for this very important program.
Unexplained symptoms like chest pain, shortness of breath, dizziness, or heart palpitations? If so, a Holter monitor test might be right for you. What is a Holter monitor? A Holter monitor is a small, portable device that records your heart's electrical activity over a 24-hour period or more. It's like a mini EKG you wear all day. Who needs a heart monitor? Well, it's often recommended for individuals with known heart conditions. A Holter monitor can also be used for general heart health checkups, especially for athletes or those with concerns about their heart rhythm. How does it work? The Holter monitor consists of a small recording device and adhesive electrodes placed on your chest. It continuously records your heart's electrical activity, allowing your doctor to identify any irregularities. With the ECG 247 app, you can monitor your heart rate and rhythm in real time as you perform your daily activities like showering or exercising. Your doctor can also remotely access your heart data to provide expert analysis. For more information, contact us on 0979-904046 and email us at info@teledoctorzambia.com or search for our website at teledoctorzambia.com. Patient app registration. After downloading the Teledoctor application, to sign in, click on the Sign In button. This will lead you to a page where you can create your own account. Fill in your phone number and email address with a valid email address. Create a new password, being careful to add an uppercase letter, a lowercase letter, a special character, a number, and a minimum of 8 characters. Fill in your names, sex, date of birth, and click to agree to the terms and privacy policy. Then, click the sign up button, which will redirect you to the login page. Fill in your email address and await a one-time password in your email inbox. To complete the two-factor authentication, copy and paste the number emailed to you and press the login button. Then, welcome aboard! You would now have effectively signed in and are now ready to use the Teledoctor application.
Ladies and gentlemen, you're back with us here on Teledoctor, and we are discussing basic first aid. And like I said, we're here with a very special guest, Sister Mwela, who has been unpacking so many gems on how we can navigate first aid in such instances whereby there's so many instances where someone can either faint, have a heart attack, and we need to apply some knowledge and some wisdom on how to navigate these situations. So Sister Mwela has been elaborating on how to go about this. And before the break, just a quick reminder was that Teledoctor app is ready for you to download. And if you've got any questions as we are having our program, please feel free to call us on 0979 90 40 46. And you are able to also drop us a message on Facebook or a comment if you'd like to ask any questions. So getting back onto our topic, Sister Mwela, we've discussed elaboratively about first aid and how to do it the correct way. But like we already mentioned, that most people are likely to do it the wrong way. And what are these common mistakes that you have noticed people making so that we can quickly correct them as they're listening on this show?
Okay. So one of them, the first one and the most common, is mishandling. More especially in a road accident situation, you will see people just pulling people. So in emergency and trauma, any traumatic injury, we always suspect a cervicospinal injury. Okay. So our first goal will be to protect.
The cervicospine would be the neck,
the
right?
neck.
Yeah.
Okay. So the first goal will be to protect this neck, because you don't want to worsen the injuries that are there. Either so there's anything until you rule it out. You've done the X-rays. You're satisfied that there are no neck injuries or spinal injuries, then you can handle the patient anyhow. But at that particular time, you need to handle them in such a way that you don't worsen things. But then in our situation, you will just see people pulling people, throwing them in a van. I think I watched a video once on Facebook where I saw a husband and wife were involved in a road traffic accident. The wife was very much pregnant. And they were just, they were literally being carried like that and being thrown into the car. And by the time they were getting to the hospital, both had passed away. Then maybe children are playing and someone is playing with a marble, anything, groundnut, anything, and suddenly they're choking on it. Unless you can see it, then you can try to remove it. But if you can't see it, don't even push your fingers into the mouth. Just probably try to do the Helmich maneuver, which is another situation for another day. Which will be, those compressions that we
trying to apply pressure.
If you know how to do that, then you can go ahead and do it. If you can't, maybe call for help. But all these are things that we need to be teaching people, especially mothers and fathers, because they've got these little children and you never know what they are going to do. If you can't see anything in the baby's mouth, don't even try to put your finger there and remove it, because you will just push it any further. Yes. Then the other one,
but just on that one, Sister, sorry to disrupt your train of thought. We now have social media. We have TikTok, we've got YouTube, which is, at our disposal. Would you recommend that people go on YouTube in this instance? Because that's the first thing I'd do, to be honest.
Well, people have been doing that a lot. And if you find a credible source, not a source that just wants to make money due to the views that they get. If it's real, then you'll be lucky. You'll be real lucky to get some good information from there. Yeah, and the other one would be the tourniquet, the tying after a snake bite.
Yes.
That one, already you tie, you're occluding blood to the other limb. So by the time you get to the hospital, this limb would have lost all the blood supply because it's been cut off. So instead of just, the best is you just move them away. Anything, because blood still needs to get to that point.
That's true.
But unfortunately, we tried to stop the poison, so we'll tie it from somewhere here, and blood will keep on ending on this point, and this other point will not get blood supply. Yeah, and the other one would be where there is a fracture. I think we talked about the fracture and people the crack. But because we've mishandled them, it has now become a whole complete fracture.
Okay.
Yeah. So I think the first thing that we need to do in an accident victim, any person who has fallen, anything, whether it's heart attack, we need to just move them calmly, position them, align them in a position that they are comfortable in. If they are able to sit them up in a position that they are comfortable in. Don't pull people like it's a bag of meal that you're pulling. Yeah, just do it, even if you're not a doctor or a nurse, but just do it in a dignified manner.
That's true. Yeah. That's true. That's true. Ladies and gentlemen, this is so insightful. I'm learning a lot. So I just wanted to throw it in there. If you still have a question or you've got something that you want to ask, there's a number that's scrolling below. Please do dial in and ask. It's better you ask than for you to do the wrong thing and we end up mishandling our patients, which could ultimately lead to death. So feel free to ask any question. There's a number that's scrolling below. Dr. Blessings, let's get into our myths and facts.
Yeah, so Sister Mula, this is now like your exam. So just tell us whether it's true or false and just give a brief 30 seconds explanation as to why the answer could be true or false. The first one is put butter, oil or raw eggs on a burn. I think I would even love to add urinate on a burn.
No, that's
false. Is this true or false?
Okay. That's false.
Okay.
Because the correct way is just run cool water.
Okay.
Yeah. Just run cool water through it while you're trying to get the patient to the hospital.
Okay.
Putting butter or raw eggs, you might just promote bacterial growth.
Right.
All these will not help. There's no scientific explanation towards this. Yeah.
All right, correct. Number 2, tilt the head back when having a nosebleed. So when someone is like having a nosebleed, they have to like tilt their head back.
False.
Is this true or false?
This is false because they need to hold their nose like that. They lead a little bit forward. Yes. Okay. You don't want them, because what you're doing is you're just promoting them swallowing that blood. But then when you make them press their nose like that and allow them to breathe from the mouth, you're promoting actually blood clotting. So it will clot and they'll stop breathing, they'll stop bleeding.
All right, interesting.
Nice.
Most of us just love like
that's the first thing. Yeah, exactly. Yeah.
Hold the nostrils
and
like that,
forward.
lean forward. If that does not work, get an ice pack, put it in between their nose.
All right.
Okay, excellent.
Make someone vomit who has swallowed poison or anything toxic, or make them take milk. So there are 2 here. Do you make someone vomit who has swallowed poison or anything toxic?
No, because you don't know the substance that they took. Maybe while this when they were swallowing this substance, it was burning their alimentary canal. So now you force them to vomit it, it will reburn again. So now you will cause damage by 2.
Okay. Do you give them milk?
Even that milk situation, I think people should invest in activated charcoal. I think it's best to have activated charcoal in your homes rather than running to buy milk.
And in which instances can we actually use activated charcoal? And where can we get it from?
In pharmacies, it is there. So I think in most drug overdose, you can use activated charcoal. at least by the time you be getting to the hospital, at least something would have been done. New York, I don't really get the logic. I don't know, maybe it helps, but I don't know.
Supposed to whiten. Just kidding. Give water to someone choking to help them.
No, you will cause more problems. Now they will aspirate because already they are choking, their airway is blocked, and you give them water, which might just go into what do they call it, the windpipe? And cause more problems.
That's true.
And you end up losing someone. So instead of just helping them, first of all, what are they choking? Is it shema? Is it meat? A chicken? A coin? Like we said, if they're able to do the abdominal compressions, better you do this rather than giving water.
All right. Okay. All right. Interesting. There you have it. So just an emphasis, please. If you are a company and you really want us to come and train your workers, we are very much available as Teledoctor, and we do offer some of these services. So please, companies, institutions, organizations, please do get in touch, and we'll be willing and very glad to be able to come and give you some of this basic first aid training, even within your workplace, because there's so many emergencies that happen within the workplace.
Exactly.
There could be a fire in your building, there could be anything. One of the employees could be choking, and at least you want to know exactly what to do in those particular instances. So thank you so much. So just to alert you on some of the clinics that are available on the Teledoctor application, of course in conjunction with Woodland Specialist Clinic, you'll be able to see them right now on your screen. So we do offer laboratory services at Woodland Specialist Clinic. And of course, for that, the number you're calling is 0979 904 046. Then, of course, we have got partnerships with different insurance companies like One Life as well as Sanlam. So if you're insured with these particular companies, you can definitely be able to access free consultations. We also have a home doctor service. If you want to access a nurse or a doctor or a pharmacist in the comfort of your home, you can reach out to us and we'll definitely be able to give this service. We have a skincare clinic for those who may be having any skin complications. Could be acne, it could be eczema, or anything on your skin. Please, this clinic is very much available for you. And then we also have a hypertension and diabetes clinic. If you want to undergo screening, or if you're already hypertensive or diabetic and you want to be managed, you can definitely get in touch with us on 0979 9046. We also have a urology clinic. So if you've got anything urological for men, prostate cancer screening is very much available. Any other complications like erectile dysfunction, premature ejaculation, those kind of issues, we do offer help for them. And then, of course, reminding you that we have a men's clinic every Saturday. So our men, please book yourself this particular clinic at Woodland Specialist Clinic, and we'll be on hand to offer those services. Let's ensure you get screened for hypertension and diabetes. If you can't, in the comfort of your home, you can also visit us at Woodland Specialist Clinic, and we'll be able to offer this particular service. We also have another clinic, a neurology clinic, for any neurological complications. If you've got epilepsy or any seizures, or if you notice anyone seizing, you can definitely reach out to us, and we'll definitely be able to offer a particular service to this particular person. We also have an orthopedic clinic. If you've got any bone complications, any bone pain, joint pains, this is your clinic. It runs every Tuesday from 14 to 17 at Woodland Specialist Clinic. So you can also get in touch, and we'll be able to offer you that service. We also have a fertility clinic. If you're a couple trying to conceive but you've not been able to, we have a clinic that can actually help you on your journey to be able to conceive, and this runs every Thursday from 15 to 18 at Woodland Specialist Clinic. Also a reminder, please download the Teledoctor application on your phones, and you'll definitely be able to access a specialist, a doctor in the comfort of your home. This is what we love to do. Dr. Tapiwa, please close us off.
Sure. This has been amazing. Sister Mila, how do you feel after that?
I'm okay.
Great. This has been such an informative dialogue, I'll say. I think I've learned a lot, especially with regards to the common mistakes that we can actually make whilst trying to administer first aid. One thing to mention is that I think we all do that out of good faith. It's not that we intentionally want to harm someone, want to mishandle them, but it's because of panic. It's because of being desperate to want to actually solve that person's problem. But it's so essential for us to be able to administer the correct and most essential steps of first aid to that particular patient. Sister Miller, I'll give you maybe just 1 minute to give us your final words on this very important topic.
Well, I think we need to get more interested in first aid, and we need to have more people trained in first aid, because these are the people that will be in the communities, and they'll be the first responders to some of these accidents should they happen, whether at home, in communities, at the mall, at the market. So we need these people. maybe, just maybe, we can save more lives.
Definitely. Dr. Blessings, any last word on this important topic?
Yeah, so my last words for me is let's ensure that everything that we are doing is being done to the best of our abilities. If you can't do something, it's always best to consult. Let's ensure we always ask for help in communities. Someone is happening, probably they're trying to faint, they fainted. Let's not shy away from asking for help. I think it's very important that we ask for help. If you can't do it yourself, probably someone might know how best to do it. And let's ensure that we're also working hand in hand with health practitioners. Let's ensure that we're always rushing people to the facility. Let's not get tired of taking people to the hospital, because ultimately that's why help is actually going to be given to them.
Definitely. And let's continue to invest as well in healthcare. It's collective support, collective help that will also help us to alleviate these particular problems and to ensure that we save more lives. Ladies and gentlemen, thank you so much for tuning in to Teledoctor. Dr. Tapio Lukuta, I've been here hosting with Dr. Blessings Kasenga with our special guest, Sister Mwila. Remember to catch us tomorrow on Radio Phoenix at exactly 9 a.m. so that we continue having this very important discussion. I've been your host, and thank you so very much. Until next time.